because there did not exist the concept of social distancing and the mask. So I really hope we can go back into the same world. That's another happy group finished in the laser training with me. So that's some batches in India. We're doing the hands-on. This is, of course, that we were doing the patient work with the laser courses that we conduct, and we were able to do it, the post-COVID, and we hope that we can resume the patient work again. These are some participants from my periodontics workshop. It's a 3-day workshop, which consists of all the clinical important procedures entailing to the subject. That's me. I'm also an associate director and principal instructor for WCLI New Delhi batch. We've done 4 batches. This is my first batch, very close to my heart. Then we have a second batch, and then we have our third batch, and this is the last batch that we conducted in March 2021. So it's a 3-day program which consists of soft tissue lasers, all tissue lasers, whitening, photobiomodulation. We have lectures, we have specialty lectures, we have extensive hands-on training, and we do have the patient work. So the best part of the course is that the participants get to perform the laser procedures on the patients. The next batch we have announced is 7th, 8th, 9th August. It is in New Delhi 2021. If anybody is interested, we would be happy to get in touch with you. Please, you have the email and the phone numbers on the screen. Get in touch with us. I have been very fortunate to have received awards in the 2 specialities I've practiced. This is me, Best Periodontist of the Year 2018 Foundant Award, and Most Promising Dentist of the Year for my contribution in laser dentistry 2019. Coming on to the topic, all tissue lasers in the management of periodontal disease. Now, before we understand the role of lasers in periodontal disease, it is imperative to understand what is a periodontal disease. Because often when I speak to my colleagues and my associates, they think the treatment of periodontal disease comprises only of scaling, root planings, and the maximum they can think of is flaps. But that is not true, because the array of the disease is just not about microbes, or it is just not about the infectious disease. There is a more important aspect, which is the systemic effect, or the effect of the pathogens that elicits on the host and the host response. So you have to be taking care of the entire complex, including the microbiology, the immunology, and make sure that you have more of beneficial species which are helping into the commensalism. So when we were discovering the etiology of a periodontal disease, we started with a specific hypothesis, and the